Hi there. I'm Jess DaMassa. Actually, no Jess DaMassa. Jess DaMassa is a friend of mine, and I am no Jess DaMassa. I am Ian Morrison. I am pinch hitting for Jess DaMassa. How could I possibly pinch hit? Matthew told me I had to go and put my kilt on and kind of spruce myself up a bit. But anyway, it's an honor, a deep honor to be here for the February 18th episode of Health Tech Deals.
So Ian, there you are with your, it's the Dan Quayle line. No, it's not the Dan Quayle, it's the Lloyd Benson line about Dan Quayle.
Exactly.
I'm surprised you didn't get the brunette wig on, but thank you very much for pinch hitting. Jess is, I believe, in the wilds of the hills of Arizona in some Buddhist retreat in Sedona or something, taking some well-deserved time off. And thanks for coming in and pinch hitting and asking me the questions, and we'll see.
No,
she, by the way, has had me replaced like 8 times. Lots of other people have done my bit, but her bit is really hard. So we'll see. We'll see how you do.
You are eminently replaceable, but she is not. So this is kind of like we go from Beauty and the Beast to grumpy old man. It's a different gig. But anyway, no, I'm flattered to be included.
All right. So for people who don't know you, I know we worked together 25 plus years ago into the future, but you've been sitting in Silicon Valley, but been looking at the American healthcare system for a damn long time, despite the Scottish, Canadian, Californian accent you have. Yeah.
No, I've been doing this a long time. And I actually look to you and Jess to monitor the digital health space. I mean, I kind of helped think it through at the very beginning, when we launched you and unleashed you on the world in the 1990s from the Institute for the Future. So but you guys do an amazing job on this show, keeping up with all that's going on in the marketplace. And you gave me the secret sauce to work off of, which is the database. And I've deals to.
Don't tell anyone there's a database. They might want access
about them.
All right, fantastic. All right, are you ready to go?
Yeah, you got the wee chicken thing.
I've got that. The chicken thing comes later, but you'll see the clock go. And don't forget the rules, which is that once you see this go, so long as you'll probably hear the alarm, so long as one of us is speaking when the alarm goes, so long as we can answer the last one. Okay, you ready?
I got it.
Go.
Okay, straight out the gate, MindMaze raised $105 million for a total of $340 million.
Okay, this is a sort of video game. It's a digital therapeutic, but it's got like hardware. It's also got like software. They've got like a coat you wear. But this is for people with stroke, Parkinson's, other complex neuro diseases. And money came in Concord Health Partners, and you're an advisor to them, right? Isn't that the
I'm conflicted. I can't say anything about it. I mean, you've said wonderful things, but
hopefully you know something.
We'll talk great team at Concord, and I trust their judgment. Okay. Memora Health, 40 million raise for a total of 50 million. What do they do?
Yeah, interesting newish company. Money came from some of the big guys, Transformation Capital, my old buddy, Julie Murchison's there, but Andreessen Horowitz and some others in that. This is kind of a thing which is trying to go on the inside of hospital systems, figure out what is actually going on between Epic and all the other stuff that's on sticky notes, and take all that through some kind of AI system and build it into an alerting system, which both messages patients and doctors. Highly complex. I'm going to be interviewing the CEO and finding out more about it.
Yeah, I mean, it sounds interesting in terms of helping doctors. Roe, 150 million for some astronomical total amount. I mean, is this not erectile dysfunction for young people?
It is, but it's worth $7 billion now. Their competitor, Hims and Hers, market cap is under $1 billion. So I don't know if they're doing 7 times more. If they're going to completely revolutionize primary care, if anyone's going to buy them, who knows?
Amazing. PriorAuthNow. Like, it's obviously not a navigation company, right? 25 million out of a total of 57 million.
Yeah, very similar to a company called Cover My Meds that did this in pharmacy. They're doing it for regular stuff. Difficult. Oh, we're out.
Equip.
Too late.
Equip.
We missed it. It's 2 minutes. It's 2 minutes.
Come on, I'm an amateur.
All right. We'll do it quick. We'll do it quick.
Well,
I love a quick today. Tell me how
throw a flag. I'm going to throw a flag.
Throw a flag. Okay.
I'm going to throw a flag. We've got to get Quip in at put 10 seconds back on the clock.
Right, go on. Okay, we'll put 10 seconds back on the clock.
Well, they got 58 million out of a total of 74.7 million. You have in decimal spots.
We have decimal. Call it 75. Yeah.
70, call it 75.
So this is a fascinating company. I know the CEO, Christina Saffron, very well. She started a non-profit called the Heal Foundation. She was it's a mental health company specializing in eating disorders. They've built this incredible team of approach of both family, other external peers, psychologists, and etc. Basically, she got to start. She was doing this in the nonprofit world with a thing called Project Heal. She herself founded that at age 15. She's only in her 20s now, but it was a while ago. And basically, she talked about this is kind of a replacement for doing facility-based treatment for eating disorders, which doesn't really work, or as people regress a lot. And now she's got 10 health plans in the nationwide, one Medicaid plan. We're starting to pay for this. And it's actually a great thing because this is an awful condition that people don't hear much about. And it's, by the way, leads to the most suicides of any mental health condition, which is or deaths, which is quite incredible. So I love what she's doing, and with that money, they're looking to blow it out nationwide. You should be hearing a lot more about that.
Great.
Right, we got to quit, even though we cheated, only a little bit.
Well, but the referee has the right to extend the game if under the right circumstances. That was a worthy extension. That sounds like a really worthwhile thing.
Did you see the African Cup of Nations when one of the referees just ended the game 5 minutes early? That was a bit
that's pretty brutal.
So I mean, Ian, I got to ask you about this. I don't know how much you can say if you know anything about MindMaze. I know you're an advisor at Concord Health Partners, but that's like a really complicated. I mean, it's a Swiss company. It's been around for 10 years. They've got a bunch of patents and what have you. So really, I mean, that's going after the stuff that people have really not got after, which is all that neurological stuff like stroke and Parkinson's and all that, and ALS and some other stuff in that zone. I mean, that's an interesting area. Do you hear a lot about that from your sort of the folks you stick around with in the hospital world and the plan world, those kinds of diseases?
Yeah, I mean, if you think about what I think is sort of the split going on here in the digital health space, is that a lot of the activity is for serious conditions, but they're more chronic conditions. But a massive amount of our investment in healthcare is in complex, very sick people with tough stuff. And certainly the hospitals, and there's a sort of division and strategy in the hospital world between people who are sticking to the knitting and others who are trying to engage more broadly with this new ambulatory, decentralized world. But the common thread is that all of those hospitals are still going to be complex things. So, I mean, I think this is on point with, the burden and opportunity to make meaningful improvement in care for people with complex neurological disease. I think that's kind of where the sweet spot for this particular offering was, as I understand it.
And then you told us, apparently Jess told me that you told her, so I'm calling that you told us, that we had to guess about mergers and acquisitions. So Roe, and those folks, I don't know do you think you could build a big nationwide primary care program monster out of selling Viagra, starting with selling Viagra from pharmacy? Do you think that's a possible route to get there?
No, I mean, what I was urging Jess and you to do in your show is to have a feature called, Fantasy Deal of the Week, which is your best guess of what the next big merger would look like. Well, I think there's going to be massive numbers of roll-ups. I mean, you track this more than I do.
Yeah. I would say,
it's going to be, the people with the financial muscle. And the thing about Roe and Hims and those guys is that they're not really dealing with the insured world, right? I mean, it's cash in the barrel, is it mostly?
Yeah, I mean, it is now, but it can't be eventually, right? Eventually, if you look at the other big player, if you asked to give you a merger, it would be Roe and Amazon, right? Because although Amazon's probably got a lot of the pieces and probably doesn't need it, because Amazon already has PillPack and it's now doing Amazon Cares, But at some point, I did a fascinating interview with Farzan Mostashari and Mandy Cohen.
I love them.
At Aladade, not Aildade, it's like people are calling it. But basically, it's the old story. Is how do you do primary care kind of at scale sensible primary care that's not just a feeder to doing more stuff in the big medical palaces. And I don't know if Roe can convert over there. This valuation blows my mind. I mean, $7 billion valuation, raising $1 billion. You could have bought HIMSS today on the stock market, the whole of it, for the same thing. Are they doing 7 times the revenue of HIMSS? Maybe, I don't know. But
yeah,
it's someone's going somewhere.
It may be somebody, valuing the brand, that they got out ahead of the gate, because it's not a hard thing to replicate, as you said. I mean, why would Amazon pay $7 billion for it when you could just do it, right? But you got to put, they presumably have built up users, but there's not. And look, it's the thing we did for years. I mean, we actually, everyone talks about consumerism in health, but we actually did surveys, you and I, over the last 30 years, and found like 7% of Americans would actually use their own money to do stuff. People talk about consumerism and Medicare Advantage. It's free, for God's sake. No one's writing a check.
And actually, money back. Actually, so, Sachin Jain grew Scanned Health Plan by sending people money, paying them to join up.
Yeah, so I think that's too. I do things for money as well. But no, I do think you're pointing to the fact that there is an upper limit about what people will pay, but that, we haven't saturated that yet, as evidenced by, I think, some of these plays where people are willing to pay subscriptions for a service that adds value.
Well, we shall see indeed. And given, talk about people doing stuff for money, as we're not paying you for this, we probably, and your time as well, we should probably wrap it up. But I want to thank you a lot for coming on, for playing, Jessica. And
it was an honor. It was a privilege and a pleasure. And I hope my Oscar is forthcoming.
Your Oscar will be clearly in the mail. And for those who follow along, you can follow Ian at Securve, SECURVE, one C, right, in that, on Twitter. You can follow me at Boltyboy. Jessica's not here, but as well worth a follow at Jess DaMassa. And then you can sign up for the newsletter at the Healthcare Blog, and you'll find all of these health tech deals and a bunch more in your inbox every week. And with that, thank you, Ian. Great pleasure having you on.
Good to see you.